Hello, I'm Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. For over 20 years, the American Academy of Pediatrics has associated unsafe sleeping conditions with preventable infant deaths. In Broward County alone, over the past 3 years, nearly 50 infants have died due to unsafe sleeping conditions. Statewide, the numbers are much higher. These deaths are 100% preventable, and that's why we as a community take this issue very seriously. Today we'll speak to a panel of experts about innovative efforts being introduced to help reduce the number of babies dying due to unsafe sleeping conditions. I want to welcome Michelle Reese, Executive Director of Healthy Mothers, Healthy Babies Coalition of Broward County, and Jim Carroll, Lieutenant, Fort Lauderdale Fire Rescue Department. Later, we'll hear about what the state is doing from Kim Gorsuch, Community Development Administrator for Circuit 17 of the Department of Children and Families, and a member of the Children's Services Council. Welcome, Michelle and Jim. Thank you so much for being here this morning. Michelle, I want to start with you because Healthy Mothers, Healthy Babies has been involved in the issue of fetal infant mortality for many years and trying to get at the reasons for those deaths. And at CSC, we've been partnering with you for a long time. I want to start with you explaining a little bit about the Fetal Infant Mortality Project and how that helps us understand the core reasons that get at these deaths.
Sure. The Fetal Infant Mortality Review Project, as you said, Cindy, has been a long-standing collaboration with Healthy Mothers and Children's Services Council, as well as the Broward Healthy Start Coalition. And we have, each month, we come together with a team of healthcare professionals, everything from obstetrics to perinatologists to nutritionists, social workers, basically for a perspective, a review of why babies are dying in the community. We examine why they're dying in an effort to be able to implement preventative actions to reduce infant mortality. And what the team is looking for are gaps. What went wrong? What created that poor outcome? Was there something that could, in essence, have been done differently to essentially get a different outcome? And the project is extremely important. It shapes many of the programs that at our organization we currently do, and I think it also is now integrated into our systems, our Children's Strategic Plan as well, that the Children's Services Council oversees, to be able to essentially target and plan appropriately programs and services. You also fund our Cribs for Kids program, and our Cribs for Kids program falls underneath our Fetal Infant Mortality Review, and that is we provide safe sleep education to all families in Broward County, and for any family who can financially qualify, we will provide a safe infant sleep space, and that consists of a Graco pack and play. We work with daycare providers. We also work with a number of the maternal child health providers here locally to ensure that they're trained on those practices to be able to disseminate the information consistently. One of the initiatives that came out of FEMA a couple of years ago was our Best for Broward Babies project, and part of our first initiative to really combat, I say, the sleep-related deaths that were occurring in Broward County, we implemented model behavior, which was an attempt at focusing on the main delivery hospitals here in Broward. We were seeing through our FEMA project, through the case reviews, that information was not being disseminated consistently through the hospitals to the families, and I know people question that. What does that mean? Because our healthcare professionals are experts and they are trained. Unfortunately, we have personal beliefs and behaviors that influence the way in which we practice. And so we were seeing through our case reviews that families were not getting consistency from hospitals, and families will model what they see in the hospitals. So that was our first attempt back in 2010 to start the effort as we moved into today, 2013. Over the last couple of years, we actually had a very large sleep summit where we called all healthcare professionals across the county. We brought in the head of the American Academy Pediatrics Task Force on SIDS and Sleep-Related Deaths, Dr. Rachel Moon. We were targeting first responders, healthcare professionals, anyone that we felt could potentially have direct impact, direct contact with that family member. Because at the end of the day, education and being consistent is really important.
I think one of the surprising things, first of all, SIDS, from what I understand, is no more. They're no longer considering this random death or unexplained death suddenly of a child as SIDS. Can you explain a little bit about that? Now it's sudden unexplained infant death?
Sudden unexplained infant death. New SUID legislation has been passed, and essentially what that's requiring is that there's a delineation between those deaths that fall under true SIDS, sudden infant death syndrome, and then those deaths that actually are classified as explained. And so what that means essentially is that under the umbrella of SUID, sudden unexplained infant death, you have SIDS, and then you also have those explained deaths. On the explained side, you have deaths that are accidental, the trauma, the poisoning. When an autopsy is done and you have the opportunity to get all of those records, a genetic and family history on the family, and after everything has properly been completed, if after all of that and a proper death scene investigation has been done, and you still have no definitive answers, then a death can be deemed SIDS. But if in fact that death, once reviewed and examined, shows contributory factors like an unsafe sleep environment, it has to be deemed as SUID, explained with contributory cause of unsafe sleep environment.
And that sleep environment situation, that's been very fluid. I know back when I was a kid and I worked in a newborn nursery, we were told, swaddle the child, put it on its side. And now that is completely wrong, right? So you do have, I want to just talk a little bit about those parents that you said, you know, they go back to custom, they go back to what they remember.
Correct.
Maybe they babysat when they were young, and that has changed. What is the proper way to put a baby to sleep now?
The proper way, according to the American Academy of Pediatrics, is flat on the baby's back. No bumpers, no blankets, no stuffed animals, nothing in the crib except a tight-fitted sheet. In fact, there are new regulations about cribs as well, but in fact, as long as it's a safe sleep space, no bed sharing, room sharing are the recommendations of the American Academy.
No room sharing either?
Room sharing, not
room
bed sharing.
sharing, not bed sharing.
Correct, exactly. And I think one of the challenges is, and it faces every demographic, and it doesn't matter regardless of your background. People just naturally assume it's never going to happen to them. Right. And in the data that we're seeing in 2013, wherein before you might have disparities existing in certain communities based on race and demographics, in 2013 there is no disparity. It is right down the middle. Sleep-related deaths are happening across the board in all communities, whether they're white or whether they're African American or whether they're Hispanic and so on. And so what we're seeing is that people are taking those risks, and you're right. Customs and myths and beliefs of what used to be done are still playing a factor in today's society. And I think that it's unfortunate that what we really need is, I think, a community awareness campaign to really help people understand that there are real risks happening out there. We recently had a mom who we had the opportunity to interview when we were doing our review process, and one of the things that she said was she had a toddler before this newborn, and she said that I slept with my baby the first time. I was taught that that was the wrong thing to do, and so I stopped. But even though I knew that it was the wrong thing to do, I did it anyway, and I've paid the hardest lesson I'll ever learn. And so it's a needless death. One of the things that we've been doing that I think is really innovative and different is working with our Fort Lauderdale Fire Rescue. And so I kind of wanted to see maybe if Jim, if you want to talk a little bit about how you came into the scene a couple of years ago and where we're at today.
Sure. Well, I've been working with the fire department since 1999, and I've been involved with many tragic infant death scenes, which are, I would never want to say they're as tragic, you know, for the fire rescue personnel as it is for the parents, but it's very tragic for the guys and the women and men who have to work on these babies that passed away. I mean, a lot of us have babies, and we take that home with us, and every time this happens in the fire department, we have a stress debriefing. A lot of guys go home, just run home to get to their kids because it's a very sad event. And I can't imagine what would happen to, you know, to lose a baby. So that's where I kind of come from. And then I was invited to the Safe Sleep Summit that Michelle was talking about. And basically I went there just like all the other, you know, people who attended, but I was, you know, representing fire rescue. I was very, very, you know, you could see I was working for the fire department. I was dressed like this, and I walked into the room, and they started speaking about babies that have died in Broward County, and they showed a large, visual up on the board, and they showed a dot for every baby that had died, and most of them were dying in Fort Lauderdale, in my city, and then they started describing it as a place where babies are dying, and and I'm just sitting there going, I didn't know any of this. I didn't know it. So as I sat there that day, I thought, why don't we do something to stop this? I'd rather not have to work on a dead baby for the rest of my career. That would make me pretty happy. So that's what I did. I sat and thought about, what can we do as a fire rescue department, because we have such a unique ability. If you think about it, people call us and they invite us into their home. So there we are. We can see everything. I mean, they need help. There we are. And around us are signs and clues and dangers and hazards of all sorts. And as a lieutenant, I was trained to keep my eyes open for these hazards, more of them fire-related, like exposed wires and smoke detectors and batteries and chirping this, all these kind of things. And so what I said, well, why don't we train firefighters to be able to understand and recognize safe sleep hazards? In other words, you come in for whatever reason, and there's a crib, and inside the crib are bumpers and and stuffed animals and blankets, and then there's a baby sleeping on their belly. Before, our fire rescue personnel would walk right past that and probably say, "Isn't that cute?" and then go help out. But now they stop and they say, "That's not right." And so what we've trained our guys to do is to look for these things, even if there isn't a baby necessarily in view, and after the situation is controlled and the patient or whatever reason they're there for is under control, they make a communication with the family member. Is there a baby sleeping here? I see a crib. Or a lot of times a mom is holding a baby and they say, we're working at the fire department, we have a new program we're trying to install, and where does the baby sleep? And most times they say, right here in bed with me. And right then and there, we go into save that baby mode, and we've created a program called Baby Safe Sleep program with the fire department, and that's what we've done. We've trained all our guys to keep our eyes open for babies less than 1 year of age, and when we find them, we can actually access the baby safe sleep space. And we remove hazards, we remove blankets, we remove bumpers, we remove pillows, and we educate the family why it's necessary to do so. And we've seen a huge reduction in deaths in our city, and we are taking a little bit of credit for it, because we really were known as the city that killed the most babies, and now we're at the bottom of that list.
That's great. So
we're really doing some proactive work, which is interesting, because fire departments are such a reactive business. Something bad happens and then there we are, Right. So that's the difference, and that's what we're trying to do.
And so now we're trying to spread that out to other cities throughout Broward and throughout the state of Florida, correct?
Absolutely. I mean, I think one of the key pieces was making sure that the fire rescue personnel understood the difference between SUID and SIDS, and understood all of the risk factors associated with a baby sleeping on its belly versus on its back. So I think, what Jimmy's been referencing, and it's been tremendously successful, is a process that started with, us coming in to do that collaborative training with his guys, all of these fire rescue personnel that started out in Fort Lauderdale, getting them up to speed on what's happening here locally in their own community, what are the do's and the don'ts, because at the end of the day, they're going to be in these homes that are, they're having these conversations with the family members, dealing in some cases with many different cultures, from zip code to zip code. You have very different issues that might be going on. So we have recently been finishing up trainings in Hollywood, Coral's Coconut Creek, Pembroke, Pompano Beach, Fort Lauderdale, obviously. We're still working, and now we've actually started moving outside of the state of Florida, and Jimmy trained for the first time outside of the state of Florida this past few months.
That's a great segue. Let's hear from Kim Gorsuch now about what the state is doing to help prevent these deaths.